Okay, so which of the following treatments is most appropriate for this patient? Oral calcium, oral vitamin D, oral phosphate, IV bisphosphonate, or IV calcitonin. So this 6-year-old boy is brought to the pediatric clinic by his parents who are concerned about his abnormal gait and delayed growth. They report that he has difficulty walking and often complains of bone pain. Physical exam reveals genu varum and a whitened wrist growth plate. Laboratory results show low serum phosphate levels and normal serum calcium levels. The patient's parathyroid hormones are also within the normal range. Which of the following treatments is the most appropriate at this time? So I think he has rickets, this kid.
Okay.
Calcium levels are low or normal, and PTH is normal, but his phosphate levels are low. I think it's caused by like a low vitamin D. So I think I would still give him B instead of just a phosphate.
Okay, so let's see here. Low phosphate, normal calcium, parathyroids also within normal range treatment. So I think this is a X-links phosphofatemic rickets. So this is kind of interesting to think about. The reason why I don't think it's completely just regular vitamin D rickets, right? The reason why, if you kind of look at it, if you look at kind of normal calcium levels, because if you're thinking it's true rickets, then the calcium levels should be decreased, right, with vitamin D. Because vitamin
Yeah.
D, how does vitamin D work? Like, what's the mechanism action of vitamin D? Like active vitamin D, that is.
Yeah, it increases intestinal absorption of calcium and phosphate, right?
Yeah, exactly. Right. And so if your lack of vitamin D, then you're really worried about kind of low phosphate plus low serum calcium levels. So this picture is kind of weird too. Also on top of that, if you have low vitamin D levels, right, what do you think your parathyroids are going to be?
Yeah, it's just gonna be increased.
Yeah, it's going to be increased. So you have this really mixed picture, right? So patient has symptoms of rickets for sure, right? But the lab values don't really match that vitamin D deficiency, and so you got to think a little bit outside the box here of why that's the case. And it seems like it's an X-linked hypophosphatemic rickets, which is I would say a lower yield. How do I say this? A lower yield diagnosis for sure. But something you got to be thinking about due to the fact that it's just one electrolyte that's abnormal, not all of it, right? So,
Yeah.
so probably best answer here is going to give you kind of oral phosphate supplementation because it seems like low phosphate levels causing him kind of symptoms of rickets here.